We tend to think of our bones as this solid, impenetrable fortress inside our bodies. But what happens when the enemy actually gets inside the walls? Today, we're diving into a condition where that's exactly what happens, an infection that sets up camp deep inside our very skeleton.
So let me just ask you straight up, can an infection actually hide inside your bones? It sounds like something out of science fiction, right? But the answer is a big, resounding yes. The condition is called osteomyelitis, and it's a battle that happens completely out of sight, deep beneath the surface.
All right, so with any battle, the first rule is to know your enemy. So let's pull back the curtain and get a really clear picture of what this internal invader is all about.
Okay, so at its core, osteomyelitis is what's called a pyogenic infection. And all that means is that it's a pus-forming infection, but it's happening inside the bone and the tissue right around it. It can show up as a sudden, acute problem, or it can be a chronic, long-term thing. But either way, this is serious business that needs medical attention fast. This is not a wait-and-see situation.
So you might be wondering who's most likely to face this. Well, it can really affect anyone, but some groups are definitely at a higher risk. We see it more in kids and in males, and that's often because of a higher chance of physical trauma, breaking a bone. But other things can open the door too, like being older, having a weakened immune system, or dealing with chronic diseases like diabetes.
So the big question is, how on earth does a bug get inside something as hard and solid as a bone? It seems impossible. Well, it turns out there are two main highways that this infection loves to take.
So the first path is the direct route. Think of it as an outside-in job. This happens from something like a nasty open fracture, a surgery, or a deep wound that lets germs march right into the bone. The second path is more of an inside-out attack. This is where an infection from somewhere else in your body, could be tonsillitis, an infected tooth, you name it, hitches a ride through your bloodstream and decides to settle down and multiply in the bone.
And who's the usual suspect here? Well, the number one culprit most of the time is a bacteria you've probably heard of, Staphylococcus aureus, or staph. But it's definitely not a one-man show. Plenty of other bacteria, and sometimes even viruses or fungi, can be the ones to cause all this trouble.
Now, the fight against osteomyelitis isn't always the same. It can be a short, intense, all-out blitz. Or it can turn into a long, grinding war of attrition. And that's really the difference between acute and chronic osteomyelitis.
The real dividing line here is the timeline. Acute is that initial infection. It hits hard and fast and lasts for less than a month. But if that infection digs in, hangs on for more than 4 weeks, and basically ignores the first round of antibiotics, it officially evolves into chronic osteomyelitis. And trust me, that is a much, much tougher enemy to defeat. Okay, so check out how this acute attack unfolds. It's a rapid and kind of paradoxical process. First, your body does what it's supposed to do. It sends in the troops, causing inflammation and swelling. But here's the crazy part. Within just a couple of days, that very swelling can start to choke off the blood supply to the bone. That's called ischemia. And without blood and oxygen, you get the final step, bone necrosis. The bone tissue literally starts to die. The body's defense ends up hurting what it's trying to protect.
And this is where the chronic form gets so incredibly tricky. That dead bone tissue can form something called a sequestrum. Just picture a little island of dead bone, trapped inside a pocket of pus. It doesn't dissolve or drain out easily, so it becomes a perfect, protected fortress for the bacteria to hide in and keep the infection going and going and going.
The symptoms also tell the story of these two different battles. With the acute phase, you get this huge systemic response. We're talking high-grade fevers, chills, just feeling awful all over, plus that intense, sharp pain right at the site. But with the chronic phase, it's more of a low-grade simmer. The fever is lower, and the local symptoms, the pain, the redness, the swelling, they kind of come and go. Sometimes you even get a draining sinus tract, which is literally a tunnel from the infected bone out to the skin.
Okay, so we've got a handle on the enemy. How in the world do we fight back? Let's get into the medical counterattack.
So to fight this thing, you first have to find it and identify it. It's like detective work. Doctors start by looking for clues in your blood. A high white blood cell count is a classic sign your body's at war. Then they take cultures from the blood or the wound to pinpoint the exact germ that's causing the problem. And finally, they bring in the heavy-duty surveillance gear, X-rays, bone scans, MRIs, to get a clear picture of the battlefield and see the damage inside the bone.
Once it's diagnosed, the main weapon is a long and relentless course of antibiotics. And I mean long. Treatment often starts with 4 to 8 weeks of IV medication. Just let that sink in.
That's a month, maybe 2, of getting antibiotics pumped directly into your veins. And after that, you could be on oral antibiotics for up to another 3 months. This is a siege, not a quick skirmish.
Now, when antibiotics just aren't cutting it, it's time to call in the surgeons. For an acute infection, that might just mean draining the pus. But for those stubborn, chronic cases, the procedures get way more aggressive. We're talking about actually going in and removing the dead bone. That's a sequestrectomy. Or even having to do bone grafts to rebuild the area. You can see how the mission shifts from just cleaning out an infection to dealing with its devastating aftermath. An amputation, well, that's the absolute last-ditch effort when nothing else has worked.
So winning the main battle against the infection is a huge victory, but it's really just the beginning. The road to recovery is a whole new mission, and this one falls heavily on the patient.
Yeah, a successful recovery is a full-time job. It's an active process. You're talking about keeping the bone immobilized, managing pain, performing super careful and clean dressing changes, and probably the most important part, sticking to that long-term antibiotic schedule, no matter what. That discipline is absolutely essential to making sure the invader doesn't come back.
And of course, guiding the patient through this whole intense journey is the nursing team. They are absolutely vital. They're the ones managing pain, helping with mobility, controlling the infection, and maybe most importantly, educating the patient so they have the power and the knowledge to see this thing through to the end.
So I want to leave you with this thought. We call our bones our foundation for a reason. And learning about an infection that can hide away and rot that foundation from the inside out is, well, it's a powerful reminder of how vulnerable we can be. So the real question this leaves us with is this. What does this teach us about learning to listen to our body's deepest, most hidden warnings before it's too late?